My name is Dr. Lipscomb, and I practice obstetrics and gynecology in Winston-Salem. I've been in practice here since 2005. A few years ago, when I converted to Catholicism, I was confronted with this notion that contraception was immoral and things, and to me at the time it seemed rather inconvenient, and I sort of brushed it aside. And then over the course of several years, it literally took me years of courageous patients very graciously kind of reminding me that there was another way to do this. And I would see these patients in the office who were not using contraception and were very content with using natural family planning. And then if you looked a little further, you realized that their family dynamic was very healthy, that they were in very affirming and positive marriages, and that their children were very stable. But this was the picture of family life. I had a few patients, I can think of one in particular who just very sincerely asked me, Doc, would you mind just learning NFP so that you can help me? And I thought, well, of course I want to help you, but I couldn't answer the other part of the question, would I just learn NFP? And so, months later, I found myself, my wife and I talking about it, and she was sort of coming through a conversion herself, and the two of us embraced NFP in our marriage. Once I understood NFP and understood the physiology, and then of course had observed those benefits, of course this is what I'm going to do in my marriage. And then all I want is what's best for my patients and their families. Clinically, one of the things that was a big challenge to me is, well, how do I do without, or how can my patients do without the pill if they're taking it for bad menstrual cramps or cycle irregularities or things like that? I went through a course at the Pope Paul VI Institute designed for medical doctors to help people to combat these problems without using contraceptives. And when I looked at that actually in some depth, the treatments are actually more effective, and they're certainly more tolerable. Most women, when they come to me now, I'm sort of known as the doctor who can take care of their problems without prescribing the pill for many of these things. They come to me because of that, and to see how much better they feel just coming off the pill is quite remarkable. That's become the focus of my practice, is to really try to offer a different way, and to see how pleased my patients are with being able to come off the pill or come off the shot or have that IUD removed, all of which may have been placed with all the great intentions, and to use something that's cooperative with their body in order to combat these issues that they were having. It's true healing, and that's really what I feel called to do as a doctor. People simply come to me to say, I understand you can help me to avoid pregnancy without having to take the pill. How do you do that? And these are people that the vast majority of them are not Catholic, and so we have a nice lengthy conversation about the basic physiology of it. And most often, I can get them directed to either a course through the diocese or through an instructor locally that they can learn how to do this and do it confidently. And if they decide to take a chance or to use a fertile day, they know what they're doing. And then they can really, once they learn that, it's something that can never be taken away. They don't have to go get a prescription filled every day, and they don't have to deal with the side effects from these chemicals that are not biologically naturally occurring. They really truly are liberated. To see people enter into marriage when they're well prepared for marriage in that regard, it's really quite a celebration when that wedding occurs and they feel so confident entering into marriage about knowing what their family planning is going to look like. It really is not that complicated. It really requires two things as I see it. One is a bit of patience and a willingness to learn. So those things go hand in hand. So it's not something that you simply go and just start taking every day. And I'll grant anybody who would argue that it's not convenient, it is certainly not convenient initially. But if you put a bit of effort into it and you have a bit of patience, those things will be fruitful and not too far down the road. The other requirement is that this is a respectful relationship, because obviously you can't use a natural method if you don't have mutual respect, particularly for each other's sexuality. It's something that really there should be a mutual respect and a mutual agreement in terms of using this method. The beauty to that is, again, sort of along the line of the patience, is the growth that happens in the sense that their communication is enhanced. And it's not something that just happens overnight. This is a part of growth through marriage and growth through living out a chaste marriage, is that there are times of continence and there are times of abstinence, but there's also times of celebration. And when there's seasons like that, there's always something to look forward to. I think our secular culture has really done a good job of burying that notion that our sexuality is just a pleasure that we can have any time. And by God's design, it's really something more that when it's respected, it truly is a celebration. And it's something that's family affirming, it's something that's marriage affirming. Sociologic studies among users of natural family planning, the divorce rate is less than 4%. I can say that among the couples that I've helped along that path, it's very gratifying to see just how happy they are in marriage and how happy their family life is. On a personal note, I was not Catholic when I got married, and my wife was Catholic. As I trained through RCIA and was confronted here I'm an OBGYN and this is what I do for a living, confronted with that contraception problem. My wife and I were using contraception at the time, and we continued to use contraception at the time. And I look back on those years of our marriage, and I really wish I could have them back. And now we do use NFP, we use it confidently, and I can honestly say since our conversion in our marriage that we've never felt closer. I mean, it's been a real blessing in our life. I changed my practice literally on a dime. I mean, and it obviously was very disruptive for me at the time, and it was disruptive to my practice at the time. But I can also say that I've never been happier coming to work every day either, because I know in my conscience that I'm doing what is by God's design. And as a doctor, as someone who people call on to help them heal, I'm doing that very consistently with God's design. There's a lot of peace in that when I can go to work and help people to feel better and to be happier. And that's what we're all called to do in our vocations and in our occupations. It's very discouraging, for example, a patient who was put on birth control when she was a teenager for bad menstrual cramps. And of course, she's now 10 years later, she's been on birth control pills for 10 years. And what generally that has done is, in the case of someone who has endometriosis, it's just delayed their diagnosis. So she's had 10 years of internal damage done by unmanaged endometriosis. Birth control pills and hormonal contraceptives specifically have been used to sort of mask or treat the symptoms, but most often they do not treat the underlying disease. Neprotechnology is is an abbreviated term that stands for natural procreative technology, and it's something that I use on a daily basis for treatment of any number of problems, including PMS, polycystic ovarian disease, endometriosis, ovarian cysts, postpartum depression. All of these things might fall under that category. Probably one of the most important categories is in treatment of infertility, particularly in people who wish to avoid artificial fertility treatments such as intrauterine insemination or in vitro fertilization. When women and couples already chart their cycle, and we are able to take a targeted approach to identifying the underlying disease, treating that underlying disease, the effectiveness of that in achieving pregnancy actually is at least comparable to the success rates of IVF. IVF, you have a 30 to 40% live birth rate with a cycle of IVF. Nepro technology over the course of time has about a 60 to 70% effective rate. Again, in our culture of instant gratification, that might not sound so attractive, but to anybody who looks closely at IVF and the things that happen in the course of that, I think any reasonable person could arrive and say, perhaps I don't want to go down that path. I would rather be patient and restore my reproductive health and have well-timed intercourse based on my natural family planning charting. This method does work with the appropriate medical interventions. The real trick in this day and age is finding a clinician who will actually help them with that. And that's really what's become the focus of my practice, is to offer that to people, particularly people who are looking for it. There are literally hundreds of doctors around the world who have embraced this approach to women's health, and it's growing very, very quickly. Really, the more I was honest with myself and the more I was really truly listened to my patients, whether they were seeking natural family planning or not, I realized that women want other answers. They don't want to be put on the pill for every problem that they have with their cycle. And as a clinician, I started to realize that. And the beauty of, here I had taken on this newfound faith, and I was learning more about it literally every month. And this just happened to be something that slapped me in the face. But I can say that I've never really looked back. My patients are, in my opinion, more satisfied, and they're certainly very appreciative. So as a clinician, I would offer a fellow clinician some reassurance that yes, this is challenging, but if we think about what life's challenges are, they are tests of our faith. And if you think of it in a spiritual sense, you really have to inform yourself and be willing to take that leap of faith, because if it weren't about faith, then there wouldn't be a leap involved.